We talk a lot about health, diet, exercise. But what about something just as vital, our dental health?
Absolutely. A healthy mouth, it's about more than just a nice smile. It connects to everything else.
Exactly. So today we're doing a deep dive into something that could really change things for a lot of Canadians. The Canadian Dental Care Plan, or CDCP, it's expanding.
That's right. We're going to break down what this expansion means, who's eligible now, what's actually covered, the practical stuff.
And we know you, our listener, want the clear picture without getting bogged down. So that's the plan. The big date everyone needs to circle. May 2025.
Correct. That's when the CDCP opens up for eligible Canadians aged 18 to 64.
But this isn't brand new, right? The CDCP has been around in some form already.
Exactly. It kicked off back in 2023. The main idea then, and now really, is to help lower dental costs for people earning under $90,000 a year.
The government's aiming big here, trying to help, up to 9 million uninsured Canadians.
Yeah, 9 million. That's the potential reach. A huge number of people who might finally get access to needed care.
So before this May 2025 expansion kicks in, who's covered right now?
Okay, so currently it's open to seniors, 65 and over, also kids under 18.
Right.
And importantly, adults who had a valid federal disability tax credit certificate for the 2023 tax year. But keep in mind that specific coverage period ends June 30th.
Okay, good to know. Let's shift to the big change coming in May. Who qualifies starting then? What are the main criteria?
All right, there are a few key things. First off, you have to be a Canadian resident. Makes sense.
Sure.
Second, and this is a big one, you can't have access to private dental insurance.
So like through your job or maybe a family member's plan?
Exactly. Through your employer, a student plan, family member's work or pension, or even your own pension benefits. If you have access that way, you're likely not eligible for CDCP.
Okay. What else?
You also need to have filed your income tax return. That's crucial for verifying income.
Ah, the income part. The $90,000 threshold.
Yes, your adjusted family net income needs to be less than $90,000.
That seems pretty clear. But what about people who might already get some dental help through, say, a provincial program? That was an interesting point in our sources.
Yeah, that's a really important clarification. If you're getting dental coverage through a provincial or territorial social assistance program, you can still qualify for the CDCP.
Oh, really?
Yes, as long as you meet all the other criteria we just talked about, residency, no private insurance access, filed taxes under the income limit, having that social program coverage doesn't automatically rule you out.
That's huge. I could see that tripping people up. Good to clarify. Now, thinking about people already in the CDCP, the seniors, the kids, what do they need to do?
Right. So for current beneficiaries, they need to actively renew to keep their coverage going for the 2025-2026 period.
Okay. Renewal needed. Is there a deadline?
Yes, and it's important. They need to get this done before June 1st to make sure there's no gap in their coverage.
Before June 1st. And how do they actually, do the renewal?
The key step is filing their 2024 income tax return.
Taxes again?
Yep, they need to file it and get their notice of assessment back from the Canada Revenue Agency, the CRA. That's how eligibility, especially the income part, gets reconfirmed for the next period.
So, bottom line for current members, get your 2024 taxes done ASAP. Very practical. Okay,
Yeah.
let's talk about what this plan actually pays for. What services are included?
It covers a pretty good range, focusing heavily on prevention first. So you've got scaling, that's your regular cleaning, polishing, sealants to protect teeth, and fluoride treatments.
The standard preventative stuff. Good. What if you need more than that, like figuring out a problem?
Diagnostic services are covered too. Think examinations by the dentist and x-rays when they're needed.
Okay. And fixing things, like cavities.
Yep. Restorative services like fillings are included.
What about gum issues or needing a tooth pulled?
Periodontal services like deep scaling for gum disease are covered. And oral surgery like extractions is also part of the plan.
So a decent foundation of care.
Yeah.
But didn't the plan get, beefed up already back in October?
It did, yes. There was an expansion previously last October that added quite a bit more.
Like what?
Things like complete exams by specialists, crowns, even root canal retreatments. Also, removable partial dentures, overdentures, immediate dentures.
Dentures, yeah. Dentures, too.
Yeah. And even major surgical procedures, plus things related to making treatment comfortable, like moderate or deep sedation and general anesthesia, if it's medically necessary.
That really does sound much more comprehensive than just the basics. It's quite a list.
It really broadened the scope significantly.
Okay, but there's a really, really important point we need to hammer home about how payment actually works. It's not like they just send you money, right?
Absolutely not. This is critical for people to understand to manage their expectations. The CDCP does not pay money directly to the eligible members.
So how does it work then?
The plan pays the dental providers, the dentists, hygienists, denturists, etc., directly for the covered services they provide to eligible patients. It's a reimbursement system for the providers.
And the key implication for the patient, for you, the listener, is?
It means even if you are fully eligible for the CDCP, you might still face some out-of-pocket costs.
Right. Because the plan might not cover 100% of the dentist fee for every single service.
Exactly. There might be co-payments or costs above what the CDCP fee guide allows, or maybe certain services just aren't covered to the full amount. It depends on the specific service and what your provider charges versus what the plan pays.
So always best to chat with your dentist beforehand about potential costs.
Definitely. Have that conversation up front so you know what to expect. Don't assume everything will be zero cost just because you're eligible for the CDCP.
Okay, that's a super important piece of practical advice. So let's recap quickly. Big expansion coming May 2025.
Yep. For 18 to 64-year-olds, Canadian residents, no private insurance access, filed taxes, family income under $90.
If you're already in, remember to renew file those 2024 taxes before June 1st.
Crucial.
The coverage is pretty broad now. Preventative, diagnostic, fillings, extractions, gums, plus those expanded services like crowns, root canals, dentures, some surgeries.
A solid range of services.
But the plan pays providers, not you. And you might still have some out-of-pocket expenses. Talk to your dentist.
That sums it up nicely. It's about making care more accessible, but understanding the details is key.
Definitely. So here's something for you to think about as we wrap up. How could this CDCP expansion potentially affect you or maybe your family members? Is this something that might open doors to dental care that weren't open before?
It's worth checking out the official government websites for the nitty-gritty details, especially on how to apply once that May expansion goes live.
And maybe think a bit broader, too. What could this mean for public health overall in Canada if potentially millions more people can get regular dental checkups and treatment? Something to chew on.